4 harmful vitamins you should avoid completely, and 4 essential ones you must take every day if you are over 65. Imagine if the pills you consume daily are actually harming you gradually. According to the Johnson Medical Association, seniors who consume inappropriate supplements face up to 40% higher chances of premature death. This is not sensationalism, but backed by scientific evidence. One vitamin on this list has been connected to shrinking of the brain, while another raises the likelihood of stroke, nerve damage, and heart failure even at normal doses. And you probably take it daily. As you age, your liver slows down, your kidneys no longer eliminate excess substances as efficiently, and your nerves become more delicate. These vitamins accumulate and poison your cells, causing symptoms you might mistakenly attribute to aging. However, it is not inevitable. It can be prevented. In this video, we will reveal the 4 vitamins you must absolutely avoid after 65 and the 4 crucial supplements you should incorporate into your daily routine. Stay with us until the end, because the first vitamin on the beneficial list is associated with a 36% reduction in death from all causes based on a significant European study. Before we dive in, comment below telling us where you are watching from. Let's first discuss the harmful vitamins, beginning with one that seems innocent, yet can silently cause severe damage over time for older adults. Number 4 is vitamin A in its retinol form. Vitamin A is often seen as beneficial since it supports your eyesight, immune defenses, and even people over 65 need to be especially cautious about vitamin A intake, particularly when consuming multivitamins or liver-derived supplements. Excessive amounts of vitamin A, mainly in the retinol form, can gradually accumulate in the body and cause toxic effects. Many are unaware that vitamin A is fat-soluble, meaning it is stored in the liver and fatty tissues rather than being excreted quickly like water-soluble vitamins. As we grow older, liver function declines and fat metabolism shifts, so vitamin A does not just vanish, it builds up over time. This slow accumulation can lead to toxicity with symptoms that may be easy to miss, such as dry skin, dizziness, blurred vision, and joint pain. These signs may be mistaken for normal aging, but could actually indicate chronic vitamin A overload, especially if daily supplement intake exceeds 2,000 to 3,000 micrograms. The danger increases further according to a 2022 review published in the European Journal of Clinical Nutrition, which revealed that excessive vitamin A consumption among older adults corresponded with a 25% greater risk of developing atrial fibrillation. This irregular heartbeat significantly raises the risk of stroke for people beyond 65 years old. If you are over this age and still using supplements containing retinol or retinol palmitate, it is wise to reconsider your regimen. Your body requires vitamin A, but not this particular form. Instead, relying on foods such as sweet potatoes, carrots, spinach, and eggs provides vitamin A as beta-carotene, a safer compound. Your body can regulate by converting only what it needs, rather than storing harmful excess. Beta-carotene converts into vitamin A as needed, so the chance of overdosing is nearly non-existent. However, if your multivitamin still contains retinol, be sure to check the label closely. Consuming more than 700 micrograms daily for women or 900 for men can be harmful, especially over an extended period. The safest option is to completely avoid synthetic retinol and rely on natural sources from whole foods. This is your first alert. Now prepare for vitamin number 3, which carries even greater risks and is frequently suggested for older adults without adequate testing. Number 3 is iron as a supplement. Iron is vital for health, but for older adults, iron supplements might turn into an insidious problem. If you are over 65 and taking iron as a precaution, this habit might be causing more damage than benefits. Many believe iron helps combat exhaustion. Doctors often recommend it for anemia, and it is commonly included in multivitamins aimed at seniors to address tiredness or weak nails. However, the real fact is that after the age of 65, your body no longer loses iron the same way as before, and excess iron accumulates rather than disappearing. Unlike nutrients that dissolve in water, iron is mostly stored in organs such as the liver, heart, and pancreas. Over time, excess iron leads to oxidative stress, when unstable molecules harm cells, cause inflammation, and accelerate the aging of internal organs. It also promotes the creation of lipid peroxides, which are damaging compounds connected to diseases like Alzheimer's, cancer, and heart conditions. Unfortunately, very few older adults are aware of this risk or receive proper monitoring for iron levels. Men do not require iron supplements after puberty. Women also stop needing extra iron once menopause begins, unless there is a confirmed iron deficiency or blood loss caused by surgery, ulcers, or a chronic illness. Most people obtain sufficient iron from their regular diet. Foods like meats, beans, leafy vegetables, and even fortified cereals naturally provide iron. Adding a supplement on top of these sources can tip the balance and lead to long-term health problems. Signs of having too much iron can be subtle and easy to overlook, including joint discomfort, exhaustion, memory difficulties, or irregular heartbeats. These symptoms are frequently mistaken for normal aging, but excessive iron silently damages vital organs such as the brain, liver, and heart. Unlike low iron levels, which can be quickly treated, high iron accumulates gradually and the resulting damage might already be irreversible. If you currently use a multivitamin containing iron, it is wise to stop and consult your doctor. Ask for tests such as serum ferritin and transferrin saturation, which reveal how much iron is stored in your body. High iron levels may require cutting back on red meat consumption and discontinuing all iron supplements immediately. Choosing multivitamins without iron becomes especially important for older adults. Although iron can be beneficial for younger individuals, past the age of 65, it acts like adding fuel to a fire, overwhelming weakened organs and causing harm. Now, moving on to vitamin number 2, which is even more widespread. This supplement is commonly used daily by conscientious seniors but may quietly be draining your bones and muscles without obvious signs. This vitamin is calcium, another essential yet potentially risky nutrient when taken improperly. Calcium has long been a familiar name as an individual supplement. It appears in every advertisement aimed at seniors for bone health, in almost all pamphlets found in doctors' offices, and in nearly every multivitamin marketed for strong bones. However, what many people over the age of 65 may not realize is that calcium supplements, especially when consumed alone, can actually raise the chances of heart attacks, strokes, and harmful artery hardening. This is not a scare story, but a conclusion backed by scientific research. Calcium is indeed vital, yet the location where it settles in your body is far more important than the quantity you consume. When you are young, your bones behave like a sponge, absorbing calcium rapidly with the assistance of hormones and growth substances. But after the age of 65, particularly in postmenopausal women and older men, this process slows down. Bones lose their ability to absorb calcium effectively, and the surplus calcium does not just vanish. Instead, it accumulates where it should not be found, in your soft tissues, joints, and most alarmingly, in your arteries. Most elderly individuals are not informed of this. They take calcium, assuming it acts as insurance for their bones, but their bodies cannot properly manage it without additional support. Rather than reinforcing bones, it hardens arteries, and instead of protecting against fractures, it increases the likelihood of stroke. To make matters worse, Calcium supplements may cause digestive problems such as bloating and constipation and can reduce the absorption of other essential minerals like zinc and iron. Moreover, if you are using acid-blocking drugs for acid reflux, which is common among seniors, your stomach will not be able to absorb calcium adequately anyway. If you rely solely on supplements for calcium, you might end up with poor digestion and gain no real advantage for your bones while adding unnecessary strain on your heart. So what is the smarter choice? Obtain calcium through natural foods such as leafy green vegetables, sardines that include bones, yogurt, almonds, and chia seeds. These sources provide calcium in a safer and more bioavailable form, which your body can absorb and utilize more effectively. The calcium from food is far better processed, avoiding the dangers of excessive supplementation. Should you require additional calcium, ensure it is paired with vitamin D3 and vitamin K2, as these vitamins help direct calcium into the bones and keep it from accumulating in the arteries. If your multivitamin still contains 500 to 1,000 milligrams of calcium and you already consume a calcium-rich diet, it might be time to reconsider your approach. Remember that strong bones depend not only on calcium, but also on balance, regular movement, and proper guidance. Your heart, meanwhile, relies on you to maintain calcium in the right places where it benefits rather than harms. Coming next is the most hazardous vitamin for seniors, a supplement often recommended, self-prescribed, and closely associated with memory loss, muscle deterioration, and even increased mortality when taken without prior testing. This is vitamin number 1 on the list. Vitamin B6 in large amounts. This fact often catches people off guard since vitamin B6 is widely regarded as harmless, something to boost energy, support nerves, or lessen brain fog. It is included in many multivitamins and frequently endorsed by healthcare professionals. However, after the age of 65, high doses of vitamin B6 can silently damage your nervous system, reduce your muscle strength, and produce symptoms mistaken for normal aging, but are actually signs of toxicity. This is a critical detail that most individuals tend to overlook. Vitamin B6 is a water-soluble vitamin, so it might seem harmless because your body should eliminate any surplus. However, vitamin B6 behaves differently compared to other water-soluble vitamins. When consumed in large quantities, particularly from supplements, it accumulates in nerve tissues. Once this buildup occurs, it becomes toxic to the nerves. This nerve toxicity causes damage to sensory nerves, resulting in symptoms such as tingling, numbness, burning sensations in the feet, difficulties with balance, and even muscle weakness. Many elderly individuals experiencing these symptoms are often mistaken for having diabetic neuropathy or simply aging, when the actual cause is excessive intake of vitamin B6. The official maximum limit for vitamin B6 intake is 100 milligrams per day. Nevertheless, studies indicate that even consuming 50 milligrams daily over a prolonged period can lead to toxicity in older adults. Numerous supplements marketed as energy boosters, brain enhancers, and nerve support contain between 100 and 250% of this recommended daily limit in just one dose. Combining those supplements with multivitamins and fortified foods easily pushes intake into the toxic range without the person realizing it. Once nerve damage starts, healing is a slow process. Seniors are more susceptible due to slower metabolism, diminished liver function, and existing medical conditions such as diabetes or thyroid disorders, which already strain the nervous system. So what is a safe approach? Vitamin B6 remains necessary, but only in controlled amounts. The daily recommended intake is 1.5 milligrams for women and 1.7 milligrams for men. You can obtain enough from natural food sources like chickpeas, tuna, turkey, bananas, and fortified cereals, unless a healthcare provider has identified a clinical deficiency that requires supplementation. Blood tests have confirmed that taking high doses of this vitamin is unnecessary. If your multivitamin or nerve support supplement includes more than 5 to 10 milligrams of vitamin B6 per serving, it is time to reconsider your choice. You could switch to a formula designed specifically for seniors or consult a healthcare professional to check your levels. When it comes to vitamin B6, having more does not mean better. After the age of 65, excess amounts may cause irreversible nerve damage. That concludes the 4 hazardous vitamins seniors should avoid without medical advice. Now, let's focus on the 4 crucial vitamins that people over 65 should consume daily, listed from the least to the most vital. Number 4 is magnesium in a form that the body can absorb. Magnesium is often underestimated in significance for older adults, yet it remains one of the most essential nutrients. By the time someone reaches their late 60s, their magnesium reserves have likely diminished greatly. This decline is due to reduced absorption with age, plus increased losses through the kidneys. Many common drugs such as diuretics, acid reducers, and medicines for high blood pressure can accelerate magnesium depletion. As a consequence, symptoms like tiredness, muscle spasms, restless nights, anxiety, irregular heartbeat, and even reduced insulin sensitivity may appear. These signs often develop so gradually that they are mistaken for normal aging. However, when magnesium levels are replenished, older adults frequently notice improved sleep quality, enhanced balance, fewer muscle cramps, and clearer thinking. Magnesium is essential for over 300 enzyme reactions in the body. It helps maintain healthy blood pressure, supports nerve and muscle activities, and magnesium plays a crucial role in stabilizing blood sugar levels while also maintaining a steady heart rhythm and ensuring your brain functions correctly. A lack of magnesium has been directly associated with a higher chance of developing dementia, irregular heartbeats known as atrial fibrillation, and even type 2 diabetes. However, not every magnesium supplement is effective. Many popular options, such as magnesium oxide, are poorly absorbed by the body and often lead to digestive discomfort. For older adults, the best choices are forms that are easier to absorb, like magnesium glycinate, magnesium citrate, or magnesium malate. These alternatives are gentler on the digestive system and better absorbed by aging bodies. The recommended daily amount for seniors ranges from 250 to 400 milligrams depending on your diet and health condition. You can also increase magnesium intake through foods such as leafy greens, avocados, pumpkin seeds, almonds, and black beans. Yet because modern soil depletion has reduced the mineral content in foods, supplementation frequently becomes necessary, particularly if you take several medications. Moving on to the third vitamin, which supports more than 1,000 cellular activities, strengthens your immune defenses, and may greatly reduce the chances of cancer and respiratory illnesses after turning 65. But before diving deeper, if you have enjoyed this video up to now, please smash the like button, subscribe, and click the bell icon so you stay updated with more valuable content like this. Vitamin D3 does much more than just supporting bone health. It functions as one of the most important hormones in the body. Indeed, it is technically classified as a hormone, and after the age of 65, your body's natural capacity to generate vitamin D declines by more than 50% as you age. This happens because your skin becomes less effective at converting sunlight into vitamin D. If you spend a lot of time indoors, apply sunscreen regularly, or live in higher latitudes, your blood levels can drop significantly without your knowledge. The implications are serious since vitamin D3 deficiency has been associated with tiredness, bone loss, muscle weakness, weakened immune function, and a greater likelihood of infections. What is even more concerning is the link between low vitamin D3 and chronic illnesses. A significant review published in 2020 by the British Medical Journal found that elderly individuals lacking sufficient vitamin D had a 50% increased risk of respiratory infections and a 30% greater chance of dying from all causes, including heart disease, diabetes, and certain types of cancer. Vitamin D3 is essential to how your immune system identifies and combats threats because it activates immune cells, decreases chronic inflammation, and enhances the repair of damaged tissues. This explains why people with adequate vitamin D3 levels not only fall sick less frequently, but also heal more rapidly. Moreover, vitamin D3 supports brain health by aiding memory, cognitive performance, and emotional stability. Low vitamin D concentrations have been strongly connected to depression and a higher risk of dementia in the elderly. Unfortunately, most older adults suffer from this deficiency, and many multivitamins do not supply enough vitamin D3 to correct it. The advised intake from diet and sunlight ranges from 600 to 800 international units per day, yet research indicates that the majority of seniors fail to reach these amounts. Seniors require between 1,000 and 2,000 international units daily just to keep their blood levels healthy. If your vitamin D3 levels are already low, which is common especially during the colder months, you might need an even higher dose under medical supervision. The preferred form to take is cholecalciferol, known as vitamin D3 rather than vitamin D2. Vitamin D3 is absorbed more efficiently and is more biologically active, closely resembling what your body naturally produces from sunlight. It is available in liquid, soft gel, or capsule forms and is absorbed best when taken with meals that contain fat. Next is vitamin number 2, a nutrient often overlooked yet vital for the health of red blood cells, nerves, and the brain. Many older individuals quietly suffer from a deficiency that leads to fatigue, memory issues, and sometimes even symptoms mistaken for dementia. This is vitamin B12. People over 65 have a significant chance of being deficient without realizing it. Early symptoms are subtle and may include tiredness, forgetfulness, or tingling sensations in the hands and feet. However, if left untreated, a B12 deficiency can become severe, mimicking dementia, weakening the legs, impairing balance, and often going undiagnosed until permanent damage occurs. Vitamin B12 is crucial for nerve function, red blood cell production, and cognitive health. But with age, stomach acid levels decrease, reducing the ability to extract B12 from proteins in foods such as meat, eggs, or dairy. Additionally, commonly used medications like antacids or metformin further hinder absorption. The problem worsens the outcome you might experience. You could be consuming all the correct foods and yet gradually slipping into a deficiency. This concern extends beyond just memory issues. A lack of vitamin B12 can also lead to weakness in the legs, unstable walking, and an increased risk of falls. This happens because your peripheral nerves begin to malfunction. Many older adults assume it is arthritis or simply aging, but the reality could be something much simpler and reversible. So how can you address this? First, stop depending solely on food. After you turn 60, vitamin B12 from dietary sources is not well absorbed unless your stomach acid remains strong. A more effective choice is vitamin B12 supplementation, particularly in the forms of methylcobalamin or cyanocobalamin. These forms bypass the stomach and are absorbed directly through the mouth or intestinal lining. For seniors, the recommended dosage ranges from 500 to 1,000 micrograms daily, although individual needs may vary depending on laboratory results. Since vitamin B12 is water-soluble, the body eliminates any surplus. It can be taken as a tablet, a sublingual lozenge placed under the tongue, or as a weekly injection if the deficiency is severe. If you are over 65 and have not recently checked your vitamin B12 levels, request this test from your doctor. This might be the most critical number in your blood tests because if your vitamin B12 is low, your entire body must work much harder. When corrected, your brain, muscles, and nerves may perform as if you were a decade younger. Coming up next is vitamin number 1, the most vital vitamin for adults above 65 as it safeguards your heart and brain, bones, the immune system, and one major European study have all shown a connection to a 36% lower risk of death from any cause due to omega-3 fatty acids. The leading omega-3s, EPA and DHA, are not typical vitamins but are crucial, especially for people older than 65. These essential fats have been researched extensively, outshining nearly every other supplement, and the findings demand attention. Omega-3s offer protection to your brain, heart, joints, and even contribute to longevity. To delve into the research, a large-scale study published in 2021 by the European Journal of Clinical Nutrition tracked over 42,000 adults aged above 60. Those with the highest omega-3 blood concentrations showed a remarkable 36% decrease in the risk of death from all causes. Omega-3s were linked not only to heart health but also to prolonged survival. Another study featured in Circulation revealed omega-3 supplementation lowered the chance of fatal heart attacks in older adults by more than 45%. These figures are significant, and the effect on life quality could be even greater. EPA and DHA are critical for building brain tissue, reducing inflammation, maintaining flexible blood vessels, and ensuring proper heart rhythm. Without sufficient omega-3s, seniors face increased risks such as memory decline, irregular heartbeats, joint discomfort, and faster aging in several organs. Surprisingly, over 68% of Americans above 60 lack adequate omega-3 levels because they do not consume enough fatty fish or related sources. To properly supplement, the most reliable source of omega-3s comes from cold water fish, such as salmon, sardines, and mackerel. However, obtaining the necessary amount your aging body truly requires through diet alone is often insufficient. This is where high-quality fish oil supplements prove invaluable. Seek one that delivers at least 1,000 milligrams of combined EPA and DHA daily. If you suffer from heart conditions or chronic inflammation, you might require 2,000 milligrams or more, but only under medical supervision. Select a supplement that has been rigorously tested to ensure it is free from heavy metals and preferably contains omega-3s in triglyceride form, which enhances absorption. Consuming it alongside a meal can help minimize any unpleasant fishy aftertaste. For those who are vegan or allergic to fish, there are exceptional allergy-friendly omega-3 supplements that supply DHA directly. Omega-3s play a role far beyond just reducing the risk of heart attacks or strokes. They promote clearer thinking, smoother movement, deeper sleep, and healthier aging. These fatty acids constitute the very framework of your brain and facilitate communication between your cells. For anyone over 65, this is not a luxury but an essential part of maintaining sharpness, stability, and strength well into your 70s and beyond. Omega-3s function like a nutritional safety net. They do more than simply extend your lifespan. They help preserve the essence of who you are. You have now uncovered the reality about vitamins for those over 65. While some supplements enhance longevity, mental clarity, and physical vigor, others can silently sap your energy, cloud your mind, and jeopardize your heart's health, even when the label appears reassuring. For older adults, it is not about consuming more but about choosing wisely. You require the proper nutrients in the correct form, and appropriate dosage tailored to your age, body, and future well-being. This involves eliminating harmful additives and ultimately providing your cells with the support necessary to keep you healthy, active, and mentally sharp. So, what supplements do you currently have in your medicine cabinet? Share in the comments below which vitamin surprised you the most. If this information has opened your eyes, please tap the like button and subscribe. The Johnson Medical Association breaks down the science that helps you live stronger and longer. If you have questions or want to share your own stories, feel free to leave a comment. Thank you for watching.